Welcome to our webinar with LactaHub introducing EFBRI, an evolving ethical framework informing breastfeeding research and interventions. Thank you very much for joining. My name is Arancha de la Horra. I'm a clinical research specialist at the Global Health Network and a midwife, and I will be moderating today's session. This LactaWebinar has been organized by the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, the Global Health Network at the University of Oxford, and LactaHub, a resource for evidence-based breastfeeding intelligence. Next slide, please. Thank you. Before we begin, a few points of housekeeping. If you are joining us on Zoom, please ask your questions in the Q&A section. If you are tuning in via the Global Health Network Facebook page, please send your questions via the Facebook Messenger. We will answer as many questions as possible during the webinar's Q&A session at the end. If you cannot hear or see us, please check your computer preferences, close other programs, and check your sound level. If issues persist, you may need to close and restart the Zoom meeting or join us via Facebook. And if you have any technical issues, please type them in the Q&A box and the team will aim to assist you. And in the spirit of open access and knowledge sharing, we are recording this webinar to make it accessible for a wider audience on LactaHub. And all participants' cameras will be off and all microphones will be muted. Next slide, please. Today, I'm delighted to be joined by our special guests, Professor Nikola Biller-Andorno, co-creator of the EFBRI framework, director of the Institute of Biomedical Ethics and History of Medicine at the University of Zurich, that is a WHO collaborating center for bioethics, Dr. Katharina Lichtner, managing director at the Family Larsen-Rosenquist Foundation and initiator of LactaHub, that is a partnership project between the Global Health Network at the University of Oxford and the Family Larsen-Rosenquist Foundation. Dr. Farah Asif, clinical research administrator at the Shaukat Khanum Memorial Cancer Hospital and Research Center in Pakistan. She has led the initiative developing a policy statement and recommendation for Pakistan's ethics review framework and institution review boards, the IRBs, also known as independent ethics committees, in support of public health emergency preparedness and response. We are also joined by Dr. Stephen Ombok Muhudia, who is a specialist pediatrician at the Nairobi Hospital in Kenya. He is also adjunct professor of bioethics at Trinity International University, co-director of Trinity International University's Africa's Bioethics Initiative Program, member of the Scientific Ethics and Research Unit of the KEMRI, that is the Kenyan Medical Research Institute. Next slide, please. This LactaWebinar will be moderated by Dr. Supriya Subramani, a postdoctoral researcher and Steerboard Fellow at the Institute of Biomedical Ethics and History of Medicine at the University of Zurich in Switzerland, and me, Arancha de la Horra, and I'm a clinical research specialist at the Global Health Network at the University of Oxford. I'm also a nurse and a midwife. Next slide, please. Our program for today, we will start with an introduction about the Global Health Network and LactaHub. Then Dr. Katharina Lichtner will provide an introduction to LactaHub's LactaEthics vision, followed by a tour of EFBRI by Professor Nikola Biller-Andorno. From there, Dr. Farah Asif and Dr. Stephen Ombok Muhudia will explore the practical applications of this ethical framework. And finally, we will open the floor to questions from the participants. So let's start. Next slide, please. I will start with a brief introduction of the Global Health Network and LactaHub. The Global Health Network is a research capability building program. It was created over 10 years ago, and our aim is to facilitate research in low-resource settings and on the diseases that are a high burden in these countries. The Global Health Network is formed by member areas, also called hubs, that support research by sharing knowledge and methods. Each hub has been established to create a specific online community of researchers who can build collaborations, develop documents, share resources, and exchange information about their specific area of health or research. An example is LactaHub, that fosters a thriving community of practice in the field of breastfeeding and breast milk. Next slide, please. The Global Health Network is formed by 60 knowledge-sharing hubs on different areas, such as maternal and child health, like LactaHub, or on areas on infectious diseases, non-communicable diseases, research processes and methods. And all these hubs and communities are supported and complemented by research tools and resources such as the Professional Development Scheme, the Essential Research Skills Training Curriculum that informs the process map and the resources gateway, Site Finder, that is a tool that links research sites with collaborators planning research. We've got our flagship, the Training Center, providing pre-certified online learning with courses translated in different languages. And we also organize events such as workshops and webinars. And this year, in November, we will host our first conference in Cape Town, South Africa. And we hope to see you there. Next slide. And LactaHub is part of this community. It's a resource for evidence-based breastfeeding intelligence. It was launched in May 2020 as a partnership between the Global Health Network and the Family Larsen Rosenquist Foundation. And this community of practice is part of the area at the Global Health Network, that the area called Women and Child Health, that covers also the first 1,000 days of life. LactaHub is an open access platform, freely available worldwide, that provides scientific and evidence-based knowledge about breastfeeding and breast milk that is continuously curated by experts. And the key audiences for this content, for this hub, are health professionals, policymakers, and researchers. Next slide, please. And LactaHub offers a wide selection of resources, such as EFBRI, that is the framework that we are introducing today about is informing breastfeeding research and interventions. We also have the reference ebook titled Breastfeeding and Breast Milk from Biochemistry to Impact. This book explores factors surrounding the influence of breastfeeding and breast milk on children's health and development. And it's a valuable resource for decision makers and healthcare professionals. We have LactaMedia, that offers a collection of photos and videos that can be used by any healthcare professional to either develop training materials or to assist women with breastfeeding challenges. Provide, there is a training compendium on providing mother's own milk in neonatal intensive care unit settings. And this compendium features 34 educational videos and 23 information sheets in both in English and Spanish. We also have a toolkit for establishing and integrating human milk banks with standards and best practices that any community can follow to set up and operate safe, high quality and sustainable human milk banks. And Lactapedia, that is the go-to resource for standardized research-based terminology for lactation, breastfeeding and breast milk. And you can find all these resources and more on the hub, that is www.lactahub.org. Next slide. Now I will hand the floor to Dr. Katharina Lichtner, Managing Director at the Family Larsen Rosenquist Foundation, to provide an introduction on LactaHub's LactaEthics vision. Thank you.
Thank you, Arancha, and a warm welcome to everyone on the call from my side as well. Kai, if you can move to the next slide, please. Thank you. Just a few words on the genesis of EFBRI and what it's actually for from our side. So we have started, the idea of EFBRI is started very at the beginning when we saw, as a foundation who's funding research and other activities on a global scale, that we had much need of really doing this consistently on the same ethical standards across all our projects, to make sure that we're using the same ethical standards wherever we operate, despite the vast differences and nuances that exist from country to country. So very early on, we have actually teamed up with Nikola and started to explore how we can worked this for the foundation itself. And as we've been working on that idea, we also noted that it's important not just for us as a foundation, but it might also be very useful, you know, for others that are working in the field, because working in the field of breast milk and lactation means that very often we're working with vulnerable populations. In what capacity? You know, in many forms of shapes. And this requires that we're always very mindful of the ethical implications that this might have. And out of this, we developed a concept that step by step we would like to provide a framework that is actually practically useful for many that are working in the field, not just for us of the foundation. So rather than keeping it in-house as a backbone for our own work, we felt we'd like to expand that and share it. And the vision behind is that we are, over the years now, are building a compendium of ethical considerations in the field of breast milk and lactation that really covers all the activities from knowledge discovery to knowledge translation and to knowledge deployment. So what we're discussing today is actually only the first part of what we will expand over the next years. And the part we want to discuss today or present today is actually really focusing on breastfeeding research. What's important to us, and maybe if you want to move to the next slide, Kai, thank you. What's important for us, and I think that's really a key element to mention here, is we're not trying to deploy or create a new ethical frameworks. There are important ones around. They have been globally accepted, or at least very widely accepted. So what we have endeavored in creating EFBRI is that we wanted to take internationally accepted ethical standards and outline how those conventions and declarations are actually applicable to questions and activities in research and implementation, research and interventions in the field of breastfeeding. So it is not a creation of a new framework, but it is the interpretation of the existing frameworks in the context of the field of breastfeeding and breast milk. The other thing, and I'm sure Nikola will dive into this in more detail in her talk, is that this is a starting point. I think we see this as a practical source for the practitioners in the field, whatever their activities and responsibilities are. But at the same time, we will hope that over time it will also develop into a best practice compendium. But this only works through the involvement of many that are actually active in the field. So please take EFBRI as a starting point that now has to evolve through many rounds of community discussions and exposure and being used in order to step by step hone this in on a globally practically applicable compendium that we would hope will become a best practice benchmark that really makes everybody's life in the field easier when they have to consider ethical questions as part of their work. And I think with that, I would like to hand over to Nikola.
Well, thank you. So following up on Katharina's introduction to LactaEthics vision, I'm pleased to now give you a tour of EFBRI. And maybe first of all, before we zoom in, what delights me as an ethicist is that EFBRI forms part of the LactaHub ecosystem, which features a significant number of other valuable resources, such as, quality standards, networking, education, etc. And this is exactly what I would be hoping for, that we can mainstream ethics, that ethics will be a resource to researchers, to other members of the LACTA community, that they will consider alongside with other important considerations. So I would love to see EFBRI to be a lively piece of the puzzle. And you'll see the why I say lively in a moment when I explain to you how this is an evolving framework. Next slide, please. So you could think that having an ethical framework focused on breastfeeding research and intervention seems like an appropriate or even like an obvious idea. We have research participants that are pregnant or breastfeeding women, there are newborns, infants, and already at a psychological level, there's a strong impulse to protect this group, right? So any intervention is highly sensitive and we need to ensure high ethical standards. Surprisingly, I have to say, there is not so much out there in terms of LactaEthics. So we hope to be really contributing to the research community, hoping to make your life certainly not harder, maybe also not easier, but hopefully more efficient as you are pondering how to best shape or evaluate or consider a research protocol. The next slide, please. Now, EFBRI is an evolving ethics framework that aims to delineate ethical rules and principles guiding biomedical research involving human beings with a scope on breastfeeding and lactation. Now, what are its special features? It's obviously open access. It has a specific focus on breastfeeding and lactation. It is based on international guidance, but also on national, in this case on Swiss national guidance. I'll explain in a moment why that is the case. We aim to bridge research and practice, and with a few examples that I've brought, I also hope to make the point how we hope to build this bridge. And also it is a evolving framework in several respects. For one, it's really a learning document. We, as Katharina said, we are looking for feedback from the research community, and we're looking for those areas where clarification may be needed, more detail may be needed. And I think this at the same time will help us build or strengthen the area of LactaEthics. Also, the document is also evolving in a different sense. It really aims for an interactive format. Right now, if you've looked for it on the website, you will find a PDF. This is the status quo. We hope to go further in the future. I've just been exposed to what's called GT3. It's an AI, and you type in, explain to me in a paragraph, maximum 100 characters, why I should get a hybrid car, whatever. And you will get this very, very quickly. So I'm thinking, in the future would be good with a smart use of filters or other possibilities to really make the search of this framework really easy for researchers, so they can say, my case is research with newborns. I have, a setting with maybe socioeconomically underprivileged participants, etc. So you could really, like a menu, pick the points that are relevant to your specific proposal and then see the guidance that's relevant, while always, of course, in the background being able to consult the entire document. These are just, early thoughts, but just to say, we also think this may be evolving in terms of how it is presented. And then finally, content-wise, it's been built in a modular way. So we hope to, after we've now built this by the module focused on classical biomedical research, we'll be branching out into more implementation research, then into interventions, and then we can always consider if there are certain areas that will need more detail, like for instance, there may be a very sophisticated data science project, maybe combining registries or raising interesting forward-looking data governance issues that we have not yet addressed. So we can always enhance, expand as needed. Next slide, please. So why is there an EFBRI? Katharina has already told you a little bit about this story. So our team was approached by FLRF a few years back. And of course, FLF as a Swiss foundation wanted to ensure that projects they sponsored around the globe were in accordance with international norms and with research ethical standards in Switzerland. So this was the task that we were given. And as we went along, we realized that this might be something that might be of interest to a broader research community, given that, of course, international guidance documents such as the Declaration of Helsinki or the CIOMS guidelines have a chapter or a section on breastfeeding women or pregnant women, but there is no framework for researchers active in the field that will guide them through all the relevant considerations. So we think, of course, we need an ethics framework to protect the dignity, identity, and integrity of all human beings. But also we want to really provide a framework that can cater to a diverse range of stakeholders. And that's researchers, certainly in the first instance, but also reviewers, also practitioners, as the more we move towards not only research, but really practical interventions. Study participants, we think it's important to empower research participants, so they should have access to the same kind of checklists and frameworks that we as people from academia may have, or people who are working in ethics or in research, and a range of other stakeholders. So we really hope this will be broadly useful. And why we also think this needs to be evolving is just simply because there is biomedical research is really moving quickly, and not only the research is moving quickly, but also certain areas are also moving, considering regarding the consensus on certain ethical standards. Just an example, maybe a few decades back, it was very clear that, of course, you don't do research on pregnant women. You don't touch a pregnant woman, and you give her whatever you happen to know about her by having done the same thing for a few decades. You gathered experiences the way along. This has changed dramatically. So we need to take into account that our own understanding of ethical issues may change, and of course, this needs to be reflected in our framework as well. Next slide, please. Here you see again what shapes our normative basis. So there is a key law, a Swiss law governing research involving human beings. This is the key basis for the framework. There are other relevant laws that we've taken into consideration. And then we have also used 3 international documents. One is the Convention of Oviedo, issued by the Council of Europe. Switzerland, as a number of other European countries, has ratified the additional protocol specifically on human subjects research. And this is the only internationally legally binding document in research ethics. There are many others, like the Declaration of Helsinki, for instance, or the CIOMS standards, the international guidelines for health-related research involving humans, but they are not per se binding. They are not signed by states. They can be made legally binding if states really integrate them in their national laws. But this is what sets the Convention of Oviedo aside. It's really a legally binding document for those countries of the European Union that ratified it. And then, of course, a very fundamental document is the Universal Declaration of Human Rights. Next slide, please. So how did we put all of this together? You've seen the sources. We've taken those fundamental principles we've saw in those laws and guidelines. We then compared and consolidated them where they overlapped. Luckily, there were no major contradictions. And this is, you have to imagine that this whole field of research ethics actually evolved over a number of decades now. The Declaration of Helsinki stems in its first version from the year 64. So there has been a process. And of course, national legislation, including Swiss legislation, has also developed, taking those major documents into account. So it comes to no surprise there were no major conflicts. There are some differences, though, in how detailed certain areas are really spelled out and how explicit guidance is on certain issues. The next step was then to see what of those principles were actually relevant to people working in the field of human milk-related research. So we've held these principles against a bulk of literature, including the physiology of breastfeeding, so basic research, infant nutrition, gene-nutrient interactions, the effect of hormones, models of metabolic functions, but then also some more public health oriented research, such as outcomes of changes in diet, infant or maternal health issues, impediments to breastfeeding, and also the social and economic implications. So we've looked at a broad range of research and considered the principles of those, source text with a view to their relevance to this kind of research. And then we've had a technical advisory board that guided us along this process, and that included legal as well as medical and clinical research expertise, and that provided valuable comments along the way. Next slide, please. Now, I don't know to what extent you have been able to familiarize yourself with the framework. Let me just give you a very brief overview of the key principles. First, the framework is about research addressing gaps in scientific knowledge with respect to breastfeeding and lactation. So that's the scope of the framework. And then the framework moves on to formulate some general requirements of human research, including consent, no alternative, or the inexistence of alternatives of comparable effectiveness to research in humans, the stipulation that risks may not be disproportionate to potential benefits, scientific integrity, scientific quality, fairness with a view to subject selection, and others. So these are the general, but not nonetheless really important foundational requirements of research involving human subjects. Then there is a number of requirements regarding the infrastructure, regarding, for instance, the qualifications of the research team, or the need to actually involve a qualified physician if you have studies where medical risks might be entailed. Another important section is number 4, which details what actually needs to be covered in a research protocol, from sponsor to institutional affiliation, potential conflicts of interest, the role of incentives, how potential risks and harms will be monitored, what insurance is available, etc. So this sets a uniform standard for what needs to be covered in a research protocol. Finally, the next point is then the review by the ethics committee. And then number 6, again, is a large section on consent, fairly detailed, that specifically mentions the need for individual informed consent by the participating pregnant or breastfeeding woman. This may seem obvious, but we wanted to stress the point because we thought that there might be a temptation to say, well, a woman that may be already, maybe close to labor or may just have delivered, whatever, she may be too busy or whatever, let's just ask the person who's standing next by, such as the partner or someone else. Very important to always emphasize the informed consent needs to come from the pregnant or breastfeeding woman. And we also emphasized in this section the need, of course, for legal representation of informed consent in the case of the involvement of a newborn or minor. Then the next section is another one that's quite substantial, and that considers requirements for research involving vulnerable groups, such as group benefit, the principle of subsidiarity, minimal risks in case of no potential benefits. We are quite aware there is a critical discussion if pregnancy or the fact you're breastfeeding already constitutes vulnerability. Probably not as such. Also, other frameworks mention pregnancy and breastfeeding under a heading such as special situations. That's what the Council of Europe document does. What we have done, we have still subsumed the special situation under vulnerable groups, as we consider pregnant or breastfeeding women vulnerable insofar as there may be harm not only to themselves, but also to the unborn or newborn. So there is a section on the necessity to inform pregnant or breastfeeding women about any potential risk to the fetus or child, and how vulnerable women, pregnant or breastfeeding women, are beyond this context, beyond this fact, really depends on the context. So our stance on this is that pregnant or breastfeeding women are vulnerable with a view to this kind of additional risk that they carry of harm, but otherwise it really depends on the context, and we certainly wouldn't want to, in a very general fashion, classify this group of women as vulnerable. Then the next section deals with biological material, and this would include human milk. So, for instance, this would mean it cannot be acquired or sold as such for research purposes. And then we have, again, some sections that deal with specific situations, such as use of embryos for research, the use of placebo groups, and emergency situations. And finally, there are some stipulations regarding data protection and the right or participants to their own data. And I will now come in the next slide to a concrete example, just published study, published in the BMJ in 2004 already, that will allow us to probe a little bit what this might mean with a view to breastfeeding research. So this study is a classic example of a randomized controlled trial that's used for determining the effect of the use of bottles, cups, and dummies on breastfeeding. And the aim of this study was to determine the effect of these artificial teats on breastfeeding in preterm infants when the mother was unable to be present to breastfeed, but in general later on wanted to breastfeed. So the study sampled about 300 preterm infants at tertiary and peripheral hospitals in Australia, where new mothers and the infants were randomized to 4 groups consisting of variations of artificial teats. And the main outcome measures were full breastfeeding compared with partial and none, and any breastfeeding compared with none. Data were collected through observations within the hospital and followed up home after discharge periods of 3 and 6 months. The results showed no significant outcomes discovered for the use of a dummy, and infants in the cup feeding group were found to be more likely to be breastfed upon discharge at home, but they also had longer hospital stays. So here is a classic setup for such a study. And what are now, next slide please, the ethical issues reflected in this case? One issue that we could jump to right away is the question of the random allocation to groups. Is there really equipoise between the use of cups and bottles, for instance? Would you really withhold a dummy from a dying, a newborn? So there are questions about the legitimation for the distribution to those 4 groups, and also for how consistent you can actually keep those groups. And these concerns are actually reflected by the fairly high dropout rates. If you read that study, or maybe you will know this study anyway, there were fairly high dropout rates, particularly in the group that received cups instead of bottles. And there were quite a number of instances of non-compliance, which they monitored. So these are certainly issues that need to be elaborated already in a research protocol, that need to be discussed by an ethics committee to ensure risks are not disproportionate to the potential benefits of the research, as EFBRI would stipulate. And if we consider this a vulnerable group, which in this case of preterm babies and their mothers, I would argue there's reason to think this is a vulnerable group with all the stress involved, all the concern about the newborn's health, etc. Then this would mean that the risk should in fact be no more than minimal. And although we have these clear, and also in the international norms, clearly established rules, this still does not alleviate us from actually having these more subtle discussions and what this really means for the study protocol, for the overall setup, but also for details of implementation of the project as such. Another issue beyond the allocation to research group would be, how can we mitigate risks for forming undesirable practice, such as creating dependencies for bottle feeding? Or how can we protect non-interference with the mother's intention to breastfeed? The EFBRI would only say measures to minimize risks must be clearly stated, but just how you go about this and what it means for a concrete proposal, of course, is up to the discussions within the expert group that is putting this protocol together. There would be many more issues we could explore, such as how do you actually counsel the women before they give consent? How do you ensure informed choice? But the point I want to make here is there the relevant rules, so to speak, overall rules are present in the framework, but there is a need to specify them, to interpret them when it comes to the development of individual research proposals. Next slide, please. Here comes a second example. This is a study that was published in 2014. That's a cluster randomized controlled trial to assess the effect of participatory women's groups on maternal and neonatal health outcomes in rural Bangladesh. And the study design included control before and after analyses. Women were recruited from a previous cluster RCT, and the randomized groups were kept the same. Results were obtained through surveys and questionnaires and showed significant improvement in the knowledge of women on issues of disease prevention and management, danger signs, and hand hygiene practices. And there were also reported increases in exclusive breastfeeding for at least 6 months, decrease in under 5 morbidities, and no differences in dietary diversity scores of immunization uptake. So again, a fairly typical trial setting. What about the ethics? Next slide, please. So this study really invites us to think about ethical issues of health research in low-income countries. And one of these issues regards voluntariness. The EFBRI states participation must be voluntary. No individual capable of giving informed consent may be enrolled in a research study unless he or she freely agrees. But a concern might be that there's little option actually for women to opt out, as they are already part of a larger study, and we are talking about a low income setting. We don't know about the literacy rates and the educational status of these women, also their self-confidence in withdrawing, in speaking up to what may be perceived as authorities. So there are lots of implementation-oriented issues regarding this clear statement about voluntariness. Also, only verbal informed consent was obtained from the women in this study, whereas EFBRI says consent must be given in writing, and there can be an exemption, but the non-written consent must be formally documented and witnessed. In this study, we don't have any details how this was done, and this is another of course, issue when you discuss just published studies. There's lots of info that's not given. So of course, if you have the investigators present, there can be a more full discussion on those, what seems like a detail, but what may matter so much in the end when we talk about genuine voluntariness and genuine consent. Another issue to be looked at is payment. In the case of this study, there was a paid facilitator that was included in the data collection process of the study and who was also a local member of the society. So this, for one, raises the question, we typically discuss compensation of research participants, but we don't so much discuss the compensation of volunteers. And another issue might be that as these women supposedly talk amongst each other, participants might claim payment as well. Now, our framework says very clearly, based on, in this case, on Swiss law, no person may receive payment or any other pecuniary benefit for participation in a research project with an expected direct benefit. And if there's no expected direct benefit, they may be appropriately remunerated. So it all depends in this case if you would consider the women in this study as receiving expecting a direct benefit. You would think that women's support groups, and it was a very structured program, that there would be an expected direct benefit. So no payment with a view to these rules, but then, of course, I think we would need to have a discussion. What if, for instance, these women were very poor, they maybe had during the day to work on their farm or whatever, and they simply could not participate and sit together for 2 hours and chat about their children's health unless they received some form of compensation. And then I think the discussion that would need to take place is this maybe not a payment or benefit for participation, but is this really a compensation for incurred expenses? And this might be different. And then again, we get into an area where we need to interpret the rules and with a view to the context, really find an appropriate solution. And I think also how we would ethically consider the issue of payment might differ. If you have, let's say, a group of privileged, I don't know, Swiss or Canadian or whatever, women who just can take this time to sit together in a group and discuss health issues, or if you have maybe women who live under much harder circumstances and for whom some kind of compensation of efforts would be much more meaningful. So, and this is where you see where the framework gives some orientation, but the work is not finished. And what I also wanted to emphasize is context really matters in these issues. Next slide, please. I brought you yet another study. I won't bother you with the details because we are running short of time, but this was another cluster randomized controlled trial, which aimed to evaluate the implementation of a feeding buddies program to improve exclusive breastfeeding rates among HIV-infected mothers in KwaZulu-Natal, South Africa. Next slide, please. And what may be important here is that here we have a participant selection of women from slum groups who are also HIV positive. So we would argue this is likely quite a vulnerable sample. How can we have the study designed such that it facilitates, encourages participation while being respectful of informed choice? Quite a challenge. And as this intervention involves community caregivers that are visiting homes, privacy and confidentiality is a particular issue here. And our EFBRI says every precaution must be taken to protect the privacy of research subjects and the confidentiality of their personal information. You could say that's easily said, but how do you implement it? In this study, they had a particular challenge as the women who were enrolled in the study had to disclose their HIV status to this body they were supposed to be working with. And if you read the paper, you see that they state that quite a number of people had declined to participate. So apparently the study design was well shaped in the sense that women were given the choice right informed transparently right before being recruited into the study that they would have to disclose their status so they couldn't make a choice if the study was for them or not. So what I think, and this is the point I would like to make here, is oftentimes we have the overall guidance is quite clear, but how we do this in practice, how we implement what we want to heed as an ethical principle can be quite challenging. So maybe, as a future vision, there could be a LactaEthics community that really creates a resource, a pool with solutions, people sharing ideas about how they address certain challenges, maybe starting with the most frequent challenges and how they work in different settings or how they did not work in certain settings. So we could share this knowledge and bring it together and bridge, build this bridge from general principle through to practical implementation of these principles. Next slide, please. So EFBRI, I think, is meeting certain challenges and also has clear opportunities. The challenge is nicely summarized by the Council for International Organizations of Medical Sciences, CIOMS. The challenge to international research ethics is to apply universal ethical principles to biomedical research in a multicultural world with a multiplicity of healthcare systems and considerable variation in standards of care. So that's very true. I think that will accompany us throughout our discussions. And the other challenge is, it sounds like a very narrow focused breastfeeding research, but in fact, it's a dynamic and broad research field involving many disciplines. The opportunities are that we hope to be with EFBRI to be positioned where ethical research principles meet ethical principles governing practical implementation. I think this is where EFBRI needs to be. Also, we think explicit user feedback and suggestions from real-life cases will help build a comprehensive resource, and working towards a global understanding of ethical issues regarding breastfeeding research will facilitate international research and collaboration, review, and funding activities. And I'm nearing the end. I'd like to ask for the next slide, please. So in summary, I'd like to emphasize EFBRI is an ethical framework. It's not a code of conduct, and as such, it leaves room for specification and interpretation. Second point, context matters. Issues may appear and be, for good reason, judged differently depending on cultural, social, economic, and political factors, such as vulnerability of study participants. EFBRI, it's important to understand that EFBRI is a synthesis of relevant Swiss and international norms that are relevant to the scope of breastfeeding and lactation research. It's not a legal text as such, and it's complementary to national laws, to good clinical practice, GCP, to safety standards, and other relevant references. So EFBRI is not a text carved in stone. It's a process involving all those who are interested in contributing to protecting the dignity and rights of participants in breastfeeding research. With that, I'd like to close and thank Dr. Miriam Taibali-Pham for a key role in the compilation of the framework, and Dr. Supriya Subramani and Rosita Vinay for the work on the future EFBRI content and their assistance in the preparation of the webinar. Thanks a lot. And I'm handing over, I think, again to Arancha. Thank you.
Thank you. Thank you, Professor Nikola Biller-Andorno. Now I'm pleased to introduce Dr. Farah Asif and Dr. Stephen Mbok-Muhudia, who will discuss the practical applications of this ethical framework with Dr. Supriya Subramani. Over to you.
Thank you, Arancha. It's quite a pleasure to have this conversation with all the panelists here. It's an amazing panelist we have here to discuss. And acknowledging, as Nikola has brilliantly laid out different issues and the concerns within the breastfeeding domain. So one, we need to understand acknowledging the importance of research ethics, whether at national or international level. And our objective in this 20 minutes, which is quite a limited, but we hope to touch upon and briefly flag certain challenges and opportunities and some way forward for the practical application of ethical framework, particularly EFBRI here within the breastfeeding and infant feeding research. So the first thing which I want to ask with laying out the key understanding which came across from Nikola's presentation is that there is certain underlying ethical imperatives, that is certain ethical values, harmonized understanding or a consensus among several international ethics guidelines for biomedical research in human participants. Stephen, do you have this similar understanding, or do you think there is a lack of consensus?
Well, there is consensus, and amongst the international guidelines, there is much consensus. But as has been said during the presentation, that context matters, and interpretation of some of these principles or guidelines, the international ones, need to be interpreted in relevant to the context in which research is taking place. So the context matters, as has been said, but there is consensus on the international guidelines and principles regarding research ethics. Thank you.
And Farah, as you have been part of developing recommendation and guidelines for clinical research within Pakistan, right, as part of the ethics committees, like, do you think the ethical imperatives, like when you're looking at referring back to the international guidelines and when you're contextualizing within Pakistan, like, did you come across certain consensus, key ethical considerations, or do you feel there is certain negotiation which needs to be carried out?
Thank you, Supriya, for this wonderful question. So it is always challenging because we do have national level guidance and then we have international level guidance. So the ideal situation is when both are in line. So because from my perspective, being representative of Pakistan, which is a low middle income country, and where it is our ethics review framework is just 2 decades old. So it's quite new. It's we can expect that it is still in the developmental phases. So the challenge I see in finding a harmonization or a consensus between national level guidance and international guidance, as we have been speaking about the context. The contexts are different. the maturity of healthcare systems are different in diverse parts of the life, in diverse parts of the regions. So, so it is possible because ethical guidelines are developed in line with international guidance, and especially for the countries which are new in the field. So we can assume that we would follow international guidance when we develop our guidance. However, there could be situations, for example, when our national level guidance is not fully evolved on certain parameters. In that case, international guidance provides us a guidance. It can be used as a reference. It can be used as a proxy. But more often, ethics is more of a national matter, because researchers must abide by the national level guidance and the regulation. They must abide. So a situation comes when a national level guidance is silent on a certain topic. In that case, it is okay to use international guidance as a proxy, but this can bring a complex situation, because it might be hard in certain contexts or certain cultural backgrounds to follow or adapt international guidelines as it is. So it is ideal to have a harmony or a consensus between the national level guidance as well as the international guidance, but it is not always possible at times, and especially for a context like ours where it is not evolved, it is evolved, there might be instances that we might come across a national level gap.
Right. Could you give us some example, which I can see that you have an instances where there could be a clash? Could you just elaborate on giving certain examples, or like one example?
Right. So, generally speaking about research, as my primary responsibility is about research ethics, being part of the research ethics committee. So in Pakistan, as I said earlier, that our ethics review system is just 2 decades old. And we have experts in our field who are trying to establish and update the national level ethics guidance. But at times we feel that the national level guidance is lacking, or the national level guidance is silent on certain aspects. Let's just take an example of exempt research. When it comes to exempt research, so we are all familiar with the internationally accepted categories, what research can be exempted. But you see, it's not possible that we adopt all the 6 categories, or as per the new revision, 8 categories of exempt research. So when it comes to us, because in our guidelines, the exempt research categories are not fully defined. So at times it could be a problem for us to find a national level reference to qualify a certain type of research as exempt research. Taking another example, the issues related to liability and indemnity and injury, these are not fully developed in Pakistani national level guidance. So, so what we can do is we follow the key ethical guidance that, of course, whenever we are doing a research, we need to ensure that there is sufficient protection to human subjects research, and whenever possible, we do have indemnity insurance for any injury. But because our national level guidance is lacking, at times it is hard for us to negotiate for this, because we do not have a national reference that mandates it. So asking for it when it is not mandatory by the local level guidance, it is a bit tricky at times. So these are just 2 examples.
Right, thank you so much, Farah. And Nikola, like some of the recent studies which looks at the international guidelines, so the scholars suggest that there are many structural similarities to these varied guidelines, that international ethics guidelines. but there is considerable variability and they lack some harmonization across the globe. That's one of the global health ethics scholars, much of them, they focus on that. Could you share with us like your insights into the key areas of consensus while developing EFBRI and areas which are lacking in consensus? For example, some of the key consensus on informed consent or within the idea of research participant protection, but on regulation and collaborative partnership, it couldn't be in some of the, the human research subjects. So in EFBRI, while you're developing, could you share us more on that?
Thank you. Actually, there was surprisingly little, real disagreement or, lack of harmony between guidelines. But for instance, and I think we also have to consider that the texts that we based our compilation on is really, they stem from different times, right? So, and although they've moved through the times, for instance, the Convention of Oviedo is still a little more hesitant regarding the involvement of vulnerable groups. With the Declaration of Helsinki, you see this whole process that they've gone through over, the past over 5 decades, really, on how to tackle this issue of vulnerability. And now we have just very brief paragraphs that are actually quite open. And I think this is what we can learn from, also from specifically, I think, the Declaration of Helsinki, with all this experience, where do you need to be very detailed and very specific, and where do you really need to leave some room for this, for cultural adaptation, let's say, or for discussion, for development. And I think the current take of the Declaration of Helsinki on vulnerability is quite well taken. Earlier versions have tried to really define groups. They've tried to become much stricter and much more explicit. And I think that's the art of finding, where do we need to be very clear and very explicit, and where do we need to leave room for discourse, for really also countries, nations finding different solutions.
Right, that's true. And so having this thought, like, looking at the research stages, like the way the ethical guidelines focuses on, most of the biomedical research guidelines focus more on operation stage or like particular stages, whereas leaving out the other stages, for example, the proposal stage or a post-research stage or the publication stage. Stephen, as a pediatrician and who is part of also many ethics committees, which guidelines on infant feeding research do you refer to, whether it's nationally or internationally? And what are the key ethical considerations do you look at different stages? And do you think we need to incorporate and include more and focus on all stages? Could you give us more insights towards that? Stephen, please unmute.
Yeah, thank you very much for that question. We don't have any specific guidelines related to breastfeeding research. Breastfeeding research is, we use the same guidelines as other research, but it falls into the category where about vulnerability, because that's the main issue. And because of the fact that it is an area where you have 2 participants, whether you are talking about just breast milk or breastfeeding, there are 2 participants. There is the baby and there is the mother. And so this is an area where you have to have the interest of 2 people, and you have sometimes to determine whose interest is best served by that particular research. But we don't have specific guidelines for breastfeeding, but it falls, the specific provisions for vulnerable populations apply very much in this respect. When we talk about vulnerable populations, because in our country, female gender or women in many of our rural communities have special vulnerabilities which is related to gender. And we have gender laws, we have implications of gender in informed consent and in participation. We have issues related to incentives because of the fact that many women in the rural areas are poor, so there is poverty. So, and there is also the effect that when we are dealing with healthcare workers, there is the power differential. Our healthcare providers, our doctors, our nurses are seen as people who are very powerful. The provision, the access to healthcare is scarce, it is difficult. So anybody who comes into contact with a healthcare professional is in a vulnerable position. There is a big power differential. Those are some of the issues that we deal with. Thank you. Back to you.
Stephen, just a quick follow-up. So how do you think the best and ethical guideline or a framework would help in a context which you explain like right now? Like, for example, let's take the idea of a financial incentives. Like, how would you think we can accommodate best with the context?
Thank you again. I would start by saying that one, generally, we take very seriously the fact that there is ethically, that it is some of the international ethical guidelines, particularly the CIOMs, emphasize the respect of cultural, local cultural norms and circumstances. That's why we say that the circumstances are very special. So in our situation, the IRBs, the ethics research committees, who must approve all research that are where there are human participants, are the ones who need to be empowered, that they are sensitive, and that they pick out these ethical issues during their reviews, that there is particular attention to the areas of vulnerability which relate in the areas that I had mentioned before. So that is really the area where we can empower people, so that the check is done at that point. We have, of course, a weakness that even the good ethics committees, like the one I belong to, are not able to monitor what actually happens on the field effectively. We provide monitoring, but we cannot effectively monitor each research and see what the researchers are doing on the ground. But there is efforts to try and strengthen that. Thank you.
Right. Thank you, Stephen. Farah, like, do you want to add on to this? Like, how do best local national guideline, and if you follow it and refer to the EFBRI framework, how much we can accommodate these challenges within this framework? What, do you want to reflect on that?
Thank you, Supriya. So I think we discussed during this panel discussion, Dr. Nikola has touched about this topic, that this is important, that how much detail is provided or how much guidance is provided to a certain topic, because context would vary, the cultures would vary. And when we say context, Dr. Stephen has already provided us a wide spectrum of scenarios. What makes a woman or a lactating mother or a pregnant mother more vulnerable in a low middle income country versus a rich country? So that matters a lot. So having said that, a framework, we have already seen a very good presentation of EFBRI during the earlier part of this webinar. It has touched all the elements that should be there to make a research ethical. However, it is always a difficult topic when we are trying to make a global level or a uniform document that would fit for different context. It would be harder. It would have its own challenges. So having said that, what I believe is that if we have such a framework like EFBRI, what we need to do is we need to make ourselves and our colleagues more aware about such frameworks, EFBRI or other frameworks, which are there to help making decision-making for ethical conduct of research. Then secondly, it is important that we need to sensitize the researchers, as well as we need to train the ethics committees how to make best use of such frameworks or the guidance. The guidance is there, but it would always be tricky to use this guidance in different scenarios, in different contexts. So the ethics committees, as well as other stakeholders and researchers, they need to be sensitized, and they need to be trained on how to make best use of these ethical frameworks like this and others which are already existing. Because it would be always a tricky question how to apply an existing ethical framework, though it is made to be a globally representative tool or a framework. It is always difficult to apply it in different scenarios. The second thing we can do is providing more details to these tricky topics. For example, when it comes to informed consent, informed consent would depend on the voluntariness as well as the capacity of women to decide for themselves. For countries where the literacy rates or the health literacy of women is poor, or the women are not free in making their decisions, they are relying on their male members to take them to the hospitals for healthcare. And at times you would be surprised that the women are not making decisions for their healthcare as well as for the research. And they would simply refer that, ask my husband or my father to make a decision for myself. So in that case, to make it sensitive to different scenarios and different contexts, we need few steps like promoting its use, then training our stakeholders, training the researchers, ethics committees on how to deal with these complex issues, and applying a universally acceptable guidance to unique scenarios that we come across in our settings. So I hope this answers your question.
Yeah, thank you, Farah. Nikola, much of the breastfeeding research, which we, as we understand, also falls within the public health research domain too. And then, so the guidelines which you have referred to is mostly focused on the biomedical research point of view. So do you have in future iterations to cover the public health perspective and public health research ethics? Could you just share us your future, how you would consider to incorporate those angles?
Yeah, thank you so much. I think a lot of classical research ethics has really focused on clinical trials, right? We have so much of our thinking goes around clinical trials, but then we know there is so much more research out there that may have to do with people's behavior, maybe have to do with protective measures that are not popping a pill or something, but it's really about also how certain relationships may affect outcomes. So we have a whole different set. Also, we may not have individual research participants. We may be looking at populations. We may have to do with questions of what are we going to find out about these populations, about risks, for instance, about behaviors, and what is this going, may this have repercussions for those populations if, this new knowledge was really spread. So I think there are initiatives underway, for instance, at WHO to actually look more closely at this whole field of implementation research. And I think what a challenge will be for us is to see how we can integrate these forms of research as well into EFBRI in a way that goes beyond those these key normative texts that we've used. They were also quite heavily on the side of biomedical research. So I think certain considerations may not be there. So I think our challenge will be to see what may not be as explicit as it would need to be to also fully cover implementation research. And then I think yet another step that's as important will be to move even further. Stephen just said, we tend to look at the early stage, but then monitoring, etc., becomes, we don't have the resources for this, right? So it kind of gets out of focus. And I can contest to that for the Swiss context, for instance, exactly the same. Research is very, very much about getting the protocol written, getting it submitted to the ethics committee, getting it approved by the ethics committee, and then that's that, right? And then you, of course, in good faith, do what you promised, but no one's going to see, and you're not required to really show the same kind of enthusiasm and insistence to provide high ethical standards once you've passed this IRB approval state.
Right.
And I think this is where we need to look to. How can we also cover for one, the state after the approval, and secondly, after the research, also the practical applications. Once we have a proven method, how can we then see introducing a new method, even if it's outside a research context, may have ethical implications? And I think it would be great if this framework could be extended to also include those aspects.
Yeah, thank you so much, Nikola. So I think much of the discussions for the last, like whether Stephen and Farah has covered about the larger context, like context matters definitely, and how do we make sure the guideline which contextualizes. But within the larger global health ethics discussion in this current, and also on one hand, there's a huge critical bioethics scholars and talking about decolonizing bioethics and decolonizing global health ethics in itself. In this context, I'm asking this question. So there is an explosion of biomedical research in the resource scarce settings, which we all are aware of, right? And there are very weak regulatory mechanisms in many of the countries within Asia or within African context. So trying to confirm with some of the regulations laid down in the international regulatory text is, as even Farah was mentioning, like we try to even adhere or take sometimes even a help from an international guideline to do research in developing countries. So Farah, could you share some of your experiences? You did mention a few of the examples. Could you bring out other challenges, but also see as an opportunity to move forward with any developing or building consensus among guidelines?
Thank you, Supriya. So the opportunity is always there. As I said in my earlier part of the discussion, that having an international guidance is always gives an opportunity in case where we do not have a national level guidance, or in case the guidance is not fully evolved. So this is an opportunity that is always there. The challenge is always there because we are looking at the national level guidances. We are working in a national boundaries, and then when we collaborate, and as the more and more research is now international collaborative, and as we move ahead, whenever we are looking for funding opportunities, we need to have good answers for how to demonstrate how we are conducting ethical conduct of research. We are meeting the ethical standards while we are within our limits and while we are within our resources. So it's having a national level guidance. If in case it is not making you in line with international standard guidelines, would mean that you are losing opportunity of collaboration, or maybe a funding opportunity or a publication opportunity. So you have a push. You have a push that you need to comply to the international ethical guidance. So here I would like to give an example that in Pakistan, in our part of the world, the birth of ethics review framework dates back to the time when there was globalization of clinical trials.
Right.
So that was the time that many of the institutional review boards emerged. And when these emerged initially, there was no government directive to have ethics committees in your institutes if you are doing research. It was the researchers who took a lead, who identified the need that to remain eligible for international collaboration, as well as funding opportunities, as well as for publication. Research organization realized that they need to have ethics review boards. And this was completely without any government directives.
Right. Thank you. Right. Sorry, Farah. Thank you so much. We are running out of time, and I hope this excellent conversation continues in our Q&A session. Arancha, please, I'll take over, please.
Thank you, Supriya, and thank you, Farah, Stephen, and Nikola. Now we will open the floor to questions from the participants. So I've got the first question I've got is for Nikola. That one of our participants is asking who were the members of the Tech Advisory Board and on what basis were selected?
Yeah, thank you for this question. They were all from Switzerland, which was important because our framework is supposed to be coherent with Swiss law, right? So we had a legal scholar who's right now heading our National Ethics Committee and very familiar with medical law. We also had a neonatologist who has many years of practice at our university hospital and who was also quite research active. And we had a gynecologist. So we really had both sides, neonatology and gynecology present. Again, a scholar from the university hospital who would help us look at the clinical and at the clinical research aspects. I think as we go along, it would be nice, of course, as we now are beyond the stage of producing a, kind of the document, to really have a larger consultative process. Thank you.
Thank you. The next one is a comment, but also introduces our next webinar about it's about financial incentives. So I'll read. Thank you for a very important topic on LactaEthics. Of course, the issue of informed consent with the emphasis on informed and the timing of informed consent in the cases of lactating donors are of crucial importance and must be carefully unpacked, especially in the case of developing country populations, to ensure consent is truly informed, as most vulnerable populations also lack educational resources and lack of understanding of ethical issues. And also mentions the issue of lacta payment must ensure the avoidance of undue inducement. It's more like a comment to start some discussion. Will anyone like to comment on this?
I can, if you'd like. I think these are excellent, is an excellent comment that points to really classical issues of research ethics that we've been grappling with for so long, right? And you should think we've figured it out by now. But this is not the nature of these kind of questions, but this is really something we need to continuously negotiate and discuss together, of what the meaning of informed consent is, of what a justified or maybe even required, let's say a well-justified incentive is, and when it really becomes an undue incentive that might lead, a woman to be sent into trial by their family, whatever, because, you get all this money, although she wouldn't want to. And this is why I think we need a lively document, an evolving framework, because these questions will never have a definite answer that's done once and forever.
Thank you. We've got another question. Oh, Farah, yeah, please.
Right. So informed consent and like the issue of a voluntary informed consent and how financial incentives can impact informed consent, as well as the pressure from the family to get those financial incentives. This is a complex issue. Of course, this needs discussion. And this is important to note that a very small financial incentive, which we could consider that it is just a small compensation for maybe the transport or the food, but for a community where most of the population is living below the poverty line, a smallest financial incentive could serve as an inducement. Whereas in other parts of the world, that financial incentives might look quite small, or it could be just incentive or just reimbursement for transportation. But for poor country and for families who are living below the poverty line, this can still be impact their free decision making. So this needs to be considered. Thank you.
Thank you. We've got another question. I think this one is from Nikola. Were members of the public and patients involved with PPI, so patient and public involvement and engagement were they involved during the development of the framework? And with regards to incentives, why can it be an issue to offer a small thank you voucher to a participant at the end of a study session? And this brings again the next session as well into picture. Nikola, over to you.
Yeah, thank you. I think with the view to the thank you voucher, I think I'll leave this to Supriya when she announces our next webinar towards the end, so we can come back to this. And regarding this excellent remark about public and patient involvement, which has become so prominent, rightly so, right over the last decade maybe. All the documents that we are used have gone through an extensive consultative process. Even our Swiss laws usually go from the draft stage to an extensive public consultation. So, and the same, of course, for the Declaration of Helsinki, where, many of us may even have contributed to, earlier versions of this. So this is a very inclusive process. The same SIOMS, I think, has similar processes. So I think all these documents have been produced, most of them, let's say, with public input. I'm not sure if we go back maybe to the Charter of Human Rights of 48, the days may have been different, but I think the newer documents certainly have been produced with participation. For the synopsis that we've done, which was more of a technical exercise, we haven't had a public consultation process, but now, of course, we hope again to reach out, as I've already tried to say, to again engage a community. And I think we've now spoken about the engaging a community of scholars, but of course, if we look at what do we hope to achieve, we want to protect and to empower research participants, and if that's what we want, we better ask them, right? So I think it would be lovely if, drawing on the Global Health Network and or LactaHub, etc., if we could have this kind of involvement and make sure that we do have a prominent representation of the voice of patients and the public in this process. So I'm very much in favor of this.
Thank you. I think we've only got time for one more question, and I thought it might be good to read another one of the participants' comments and see if it brings any brief discussion. Lacta research is such a complex yet timely endeavor where collaborating is absolutely crucial. Involve partners in sharing responsibilities for determining the importance of the benefits of the health challenges, assessing the value of research, planning, conducting and overseeing, and integrating Lacta research into healthcare systems, respecting community, family values, culture, our African traditions and social practices, sharing fairly the research rewards. Will anyone like to comment on this? And then we will close. Stephen, please. You're muted. Yeah.
Yes, no, I raised my hand to make a comment, not to answer that question.
Go ahead.
I'll go after that.
Oh.
My comment will come after this question is answered. Thank you.
Will anyone like to continue with the comment that I just read? Or shall we just move into Stephen's comment? Stephen, you can go ahead.
Okay, thank you. I wanted to comment before we finish about the fact that the main framework is in keeping with the Swiss laws, and being a framework that may be used in different parts of the country. I think that it would be, I think that we should put in it that that various countries should take into account their national laws, because I know that we have several laws that relate to breastfeeding substitutes, and etc. And it would just be a good addition to indicate that the countries, that it is assumed that the specific countries will look into their own laws as they use this framework. Thank you. And back to you.
Thank you, Stephen. Could we have this slideshow again? Thank you I would like to thank all the participants for all your questions. And those questions, I think we've managed to answer and cover all, but if there are any that we haven't managed to answer, the panelists and the team will respond directly to you. And before we finish, I would like to invite you to join us on the next webinar, the use of financial incentives for participants in health research. This webinar will be held on the 13th of April, and this webinar is part of the Forum for Global Health Ethics series. Experts will discuss financial incentives in health research and health programs, and we will explore arguments for and against financial incentives, discussing cases from different regions around the world, and including the case of breastfeeding research. And you've got the link on the screen to join. And next slide, please. My sincere thanks to our special guest, Professor Nikola Biller-Andorno, Dr. Katharina Lichtner, Dr. Farah Asif, Dr. Stephen Ombok-Muhudia, and Dr. Supriya Subramani, for your time and sharing your expertise today. And to you, the participants, for your engagement, and to our team, Kai, Michaela, Alexeina, Abalena, for all the work in the background. Please help us develop EFBRI by sharing your feedback and suggestions, emailing us on ethics@lactahub.org. And a quick reminder that this lecture has been recorded and will be available soon on LactaHub. And also one of the participants was mentioning how to get hold of the slides. So they will be available in the recording, and there will be a blog as well following up. And so, to close today's webinar, I would like to once again thank all the speakers and the audience and wish you all a good rest of your day. Thank you very much, and bye-bye.